Victoria has recorded the highest number of daily cases seen in Australia since the beginning of the coronavirus pandemic. 317 is the new record number, and the Chief Health Officer says the peak may be yet to come. Another 2 men, both in their 80s, have died from the virus, and the number of active case numbers has surged past 2,000. Concerningly, the number of healthcare workers who are now either infected or in isolation is also growing. And some doctors say they're worried that staff aren't being adequately protected. Richard Willingham begins our coverage.
From cancer ward to COVID contingency, the old Peter MacCallum Hospital has been transformed, ready to take up to 84 non-COVID patients from overwhelmed Melbourne hospitals. Across town at the Monash Children's, training to properly remove PPE is hands-on.
We are ready, but I don't have a crystal ball. I don't know how this pandemic will pan out.
The number of Victorians in hospital with coronavirus has climbed to 109, with 29 of them in intensive care. But it's not enough time to trigger stage 4 restrictions. That's because the effects of the lockdown haven't had time to flow through.
An out-of-control outbreak is one where no matter what you're doing, you're seeing a really significant exponential increase. We're seeing an increase, but it's relatively slow.
The next few days of data will be critical, and there's a stark warning for those who might underestimate the threat.
And so the idea that 29 deaths is nothing, and that we can lift all restrictions and that we can let it run is absurd, because it's an exponential growth in cases when there aren't restrictions in place.
On the front line, health workers continue to get sick. The latest figures show 150 people have the virus. Even more are in isolation. And ahead of a predicted surge in admissions, the government has suspended some elective surgeries to boost capacity, while the spectre of the virus hangs over those on the front line.
The stress is there, the stress is real. We've got to find those breaks, and we've got to have that self-care. Because if we don't, then our performance deteriorates, and I know that every single doctor and nurse and healthcare worker wants to give their best. They're proud to do this.
Answers about the cause of the clusters have not been forthcoming for the opposition, with an entire 13-page Freedom of Information document about the Cedar Meats outbreak completely redacted.
It just goes to the extent of the secrecy. This is absolutely ridiculous.
Aged care centres are another big headache, with dozens of residents and staff infected. The centres are now the target of a testing blitz designed to stop the further spread of this virus into vulnerable communities. Richard Willingham, ABC News, Melbourne.
Well, the Victorian Department of Health says 388 healthcare workers have contracted coronavirus since the beginning of the pandemic. 150 of those cases are currently active. It's put an added pressure on hospitals, which are already dealing with a significant increase in COVID-19 patients. For more, I'm joined by Dr Sarah Whitelaw, who's an emergency physician and the emergency medicine representative at the AMA. Sarah, thanks for joining us.
No problem. Thanks for having me.
Now, we're hearing 317 new COVID-19 cases today in Victoria, the biggest daily jump yet since the pandemic began. What does your ED look like at the moment? Is it coping?
It is coping. It's time for the health service to enact the plans that we have spent 5 months preparing. We have changed to our new models of care, where we have divided emergency departments into being able to cope with a greater volume of coronavirus patients and sick coronavirus patients. And of course, for us in emergency, one of our major challenges is dealing with the number of people that might have coronavirus. So even though the case numbers might be at a certain level, for us, the number of patients that we see coming through who we have to test and screen because we're aware that they have risk factors that make them more at risk of having coronavirus are very, very large. So our systems have been developed to deal with that, and we've certainly enacted our new model of care in the last couple of days to deal with that. it's really important to state that the transition of the plans that have been made from paper to reality is always rough. We knew it would be a challenging period, and certainly every single half a day that we can get without a rapidly increasing number of cases is making that transition to those systems that we had planned to put in place a little bit easier and a little bit smoother, because all the planning in the world doesn't mean that transition is going to be seamless.
Is that transition complete?
No, there are a number of other plans that we have got that we can enact, and we will enact those as the need arises. So when you say is the transition complete, we're not in full inaction of all of the emergency plans that we could put in place, but we're certainly at the point where we're getting ready to enact many of those.
Which would suggest that you are expecting the situation to worsen?
Look, we need to prepare for the situation to worsen.
Okay.
I guess also prepare to deal with the unanticipated challenges that come from transitioning that planning into a reality, because there's always things that you can't quite foresee when you're sitting behind the scenes trying to plan for this.
How much as a strain has the increase in COVID-19 positive cases put on you and other frontline staff?
You need to, I think it's really important that we remember for staff that they've been dealing with the pandemic for the last 5 months. And emergency staff in particular have not had a break from this. Some areas of the health service system have been a little bit quieter in the last 5 months. We really haven't. So we've been going full throttle in terms of caring for patients, but also developing plans and systems and training staff. And so although we're prepared for this, this is certainly what we feared and knew might be coming. So we have prepared very well and are grateful for the time we've been given. We're doing it on a level of staff exhaustion, if you like, that is a little bit unprecedented. So we're expecting an enormous amount from our staff, and I think we need to be supporting them in absolutely every way possible.
So how do you support them with a number of, with respect to fatigue, but also with respect to the fact there's 150 active COVID cases amongst healthcare workers themselves?
Certainly, that is a huge concern. The Australian Medical Association is calling for the immediate setup of a national register of healthcare worker infections so that we can collect this data. We can establish exactly where the gaps in the system are and work out what we need to do to close those gaps as quickly as possible. We're comfortable that the state government, the health department, our health services are in this with us. They are absolutely aware of the importance of finding out where those gaps are. But the key is to support staff in that setting by being incredibly transparent with information. People need to know exactly what is going on. They need to know, how the risks have changed. They need to know what is being done to find out where the gaps are and what we need to do to close those gaps or address those system breakdowns that are leading to these infections, whether that's in the community or within our health systems themselves.
We heard a lot about PPE at the beginning of the pandemic and throughout as it's continued. Are you satisfied with the level of PPE being provided to you and your colleagues and the protocols that are in place to deal with the spike in numbers?
What is incredibly important is that we focus on the evolving research with regards to these to coronavirus and the new information that's going through. So the PPE requirements that we thought were adequate 2 months ago, we know now are in fact not. And certainly my health services responded incredibly well to that and increased the level of PPE guidelines for the hospital and the provision of quality PPE for staff. The Australian Medical Association is very keen to make sure that all healthcare workers are protected and wants to hear from anyone who feels that they're not able to access adequate PPE. But what we know is that we might gain more information. And as I said, every half day, every day that we can get from the community to be able to slow the rise in the number of cases means that we get more information, and we need to act on that. So if we find that higher standards of PPE are required to keep patients safe and to keep staff safe, then we need to be able to deliver that straight away.
Sarah Whitelaw, thank you for your time and thank you for doing your best to keep Australians safe and well.
Thank you. I'll pass that on.
Well, the news is much better in New South Wales. A testing blitz has found just a handful of new cases connected to the Crossroads Hotel in Casula in southwest Sydney, but authorities are concerned about 3 new infections where the source is a mystery.
For a week now, punters have flocked to the Crossroads Hotel, not for a schooner and schnitty, but one of these swabs. And as uncomfortable as they may be, every test taken is a service to self and society. There have also been long lines again at other pop-up clinics, like this one at the Picton Hotel. Across the state, almost 23,000 people were examined in the last 24 hours. 15% of those were in southwestern Sydney. Tonight, we know the Crossroads cluster has grown to 40. 3 other infections are being investigated. Disease detectives are yet to determine where they contracted coronavirus. They're asking them if they've been to any venues visited by others who were also infected.
Often it's a process of re-interviewing people several times. If anyone asks you where you've been in the last period of time, I can imagine that you probably aren't as accurate.
Straight out of Melbourne, a positive case landed in Ballina on Sunday, but that man was wearing a mask and he's been in self-isolation since he arrived. Hopefully enough to avoid another outbreak.